to advance the science and art of medicine for the betterment of society.
Before commencing today's session, here's a reminder again to sign the papers for APMC credit hours at your earliest convenience. We now begin today's session. The theme of the session is Skill as an Art of Patient Care. We are honored to have with us Dr. K.V. Ramprasad sir, MD Anatomy, Diplomate in Family Medicine, Dean Basic Medical Sciences, Senior Resource Faculty, NMC RCMET, Andhra Medical College.
Yesterday because of that.
Didn't give a pause like that.
Sir?
Don't give pauses that
So, where we go, today's session is on science of teamwork in healthcare. So we have seen teamwork in organizations. A lot of organizations, they have a teamwork. In the center, profit and the betterment of the organization is seen there when you have a teamwork in organizations. And we have seen teamwork in Operation Sindoor as well. In Operation Sindoor, we have seen intelligence teams, and then we have seen air teams, and then floor teams, and armies, and they did a lot of work, and the target was achieved. And Pakistan was devastated. So that devastating things, teamwork we have seen, and we have seen for gain, profit, we have seen organizations. But teamwork in healthcare, so this is something which was intriguing, and we just wanted to check out whether teamwork works in healthcare management. And in healthcare, when you talk of teamwork, it's an entirely different entity of its own. So this is more of a service sector, and we have to provide services to the patient who lies in the center of this picture now. And we have a lot of human resources, and at the same time we have a lot of laboratory investigations, and a lot of procedures are involved in this. And this healthcare entity, it revolves around the patient. So a lot of things are there. So we have to look at the patient safety, and some important things like if you just want to target healthcare, then we have to look at the family impact, and then the psychological aspects, so which come out from the patient. So the patient also becomes an important entity here when we are doing the teamwork in healthcare. This healthcare which was present, so nothing new about this healthcare. When you talk of individually healthcare, there's nothing new. Because initially we had a practitioner who had learned some knowledge from some books and from training and skills, and then he used to deliver solo healthcare to the patients and thereby to the community. But at a later date, what happened is the volume of literature started increasing. Immense volumes of literature has come in, and newer technologies of diagnosis and management have come into the system. And then we had a super specialist care started emerging out. As the super specialist started emerging out, then whatever the healthcare was there, so this was being administered by super specialists. These super specialists, they used to take a chunk of the knowledge, and then they used to master that knowledge along with that newer technologies which are emerging out, be in touch with what was happening on a regular basis, and then they started delivering systemic care. So super specialist care is very essential, and it was being done. Now what happened is the unified solo healthcare which was being delivered in the previous years now started being fragmented, and then we at present now we are going about with a specialized healthcare. But this specialized healthcare, though effective, it has been fragmented, and what we needed was a comprehensive healthcare module to be delivered. So this emoji says that so what if healthcare is fragmented? If it says so what healthcare is fragmented, then we have to look into the reasons. What is the outcome of having a unified healthcare, and then what is the outcome of having a solo healthcare? So once an analysis was done into this fragmented healthcare, we just wanted to check out what were the results of fragmented healthcare, and who are the persons affected because of this, and what is the system affected because of fragmented healthcare. The first person comes as the patient. A study was conducted which shows that this fragmented healthcare emerged out to be causing a lot of dissatisfaction in the patients, and a lot of patient safety measures were compromised. You can ask me, like, if super specialist care is being delivered, then why patient safety is affected? So that is the point which came out there. And then there was an increased financial burden on the patient and their families, and time was more consumed when it came to fragmented healthcare rather than unified healthcare. The next point which surfaced out was medical errors. What are the medical errors which were occurring because of this fragmented healthcare? So we have seen that interdisciplinary care errors were there. So what are those interdisciplinary care errors? If you talk of interdisciplinary care errors, so I'll be showing another slide. I'll be showing you another slide which shows how a patient goes from discipline to discipline. So in US alone, where interdisciplinary care, where a structured format is present to deliver healthcare, 250,000 deaths per annum were diagnosed to be because of lack of interdisciplinary care errors. So the second thing comes is transition care errors. So what are the transition care errors? If you talk of transition care errors, a patient is being shifted from a pre-operative ward into a surgical ward, and proper communication is not established there. It results in what we call it as a transition care error. Or a surgical patient now is being shifted into a post-operative room, and then the same thing, communication is not established there. It results in a transition error. There are medication errors also. A staff nurse, she shifts off from shift A to shift B, and the dose, the drug name, and if they're not properly communicated, they've also resulted in medication errors. So this is where coordination and collaboration was very much important, and that is where this teamwork factor came into play. So we just started looking at the care deliverers, who are the persons who are delivering care. So they were also affected. There was a lot of stress in these caregivers who were working solo in some team unit. And at the same time, there was a lot of boredom in these faculty who were doing this caregiving measures. And then loss of interest in work, and lot of injuries were also found to be seen there. And as a whole, the organization started being affected. So then we need to know how to cope up with this. Now we have seen that solo healthcare to fragmented specialized healthcare, and from fragmented healthcare, what are the deficiencies which are occurring in fragmented healthcare, and now we have to see what are the coping up measures for this. So studies have shown that the same models which have been used in other organizations, like in Operation Sindoor we have seen, and other organizations, they started picking up inputs from those organizations which were doing a better progress. And we started to look into one aspect, that is teamwork in healthcare. So healthcare team, what do you mean by healthcare team? I'll just look at only 2 points now. It's a group of professionals sharing common goals. We just end the thing now, because I can't remember definitions. So it's a group of individuals who are sharing common goals, and the common goal is the well-being of the patient. So these professionals, they come from various disciplines, and then they collaborate in between themselves, and they provide comprehensive patient care. They work together and they meet the needs of the individuals, and once the needs of the individual are met with, then the whole of the society is affected, and the public health problem now is being solved by doing a simple teamwork. So what are the key aspects of a healthcare team? So these are the key aspects. Once we form a team, a group of professionals who are caregivers, and then they give sharing a common goals, so they have to have some important characteristics. We see the patient care is a multidisciplinary approach. Again, in US, if you happen to see the statistics, so one person annually out of the US population, 1% of the population goes to a healthcare professional, and they require multidisciplinary approaches as an emergency. Like if you happen to see others who require chronic care, so there are around 6 to 7 persons are affected, and they require annually multidisciplinary approaches. So these include physicians, nurses, pharmacists, therapists, dietitians who have to work as a multidisciplinary team. The most important thing of this is they have shared goals and shared objectives. So all the members who take part in the healthcare team, they have to work towards the common goal, and the common goal being the well-being of the patient. The most important component which has to be highlighted and which has to be followed when you talk of teamwork in healthcare is interprofessional collaboration. That's where the buck stops for a minute, and then this is where we have to look at. So this requires effective communication, and then respect for each member's expertise and willingness to share responsibilities and decision making. So this is where we have to stop, and this is where we have to focus upon. And interprofessional collaboration, if it is done properly, then effective teams start emerging out. If you happen to see the CVME module, most of the module now targets communication skills, teaching communication skills, learning communication skills, and at the same time assessing communication skills. So this CVME module shows the importance of teamwork, and at the same time we are having team activities are being conducted by in the CVME module. We have small group activities, and at the same time we have other activities which are involved in in the form of self-directed learning, which not only makes the student a lifelong learner, but at the same time it also helps in coordinating activities. Like you'll be doing seminars for students, like in 10 students are there, and for the 10 students we give different topics, and all of them are made to sit together, and then they form a PowerPoint and then they present it. So this is also a sort of teamwork. And at the same time we have integrating classes now. Integrated classes are also promote interprofessional. They teach and they train the student into getting into interprofessional collaboration. Then patient-centered care. So we have the patient is the active member of the team, and their preferences and needs we have to be taken into account. Whatever the thing is, we just want to tell you that this is a dynamic process which is happening and keeps on changing from time to time, and adaptation is the most important thing the team has to cultivate, and they have to learn fast and then adapt fast in order to have an effective team. So this is only a picture, just to take you a bit from the boredom of these lectures. So if you happen to see, these are the team. So we can see an ambulance which brings an acute care patient, and then a team which does ACLS, and then they recover the patient, and then we see the patient has done a surgery is performed upon, then take paramedical staff come into play, and then you have specialists here. We have a cardiologist, and we have an endocrinologist, and we have an oncologist. So many people are coming into play, And then we have physical therapists and rehabilitation measures also being taken place in that team. And then this team is working unified. But don't forget to add one more person into the team, that is the patient. So our healthcare team, I said it's a different entity because this is the most important person who forms a member of a team. He says, no decision about me without me. You have to include him in the team in a galaxy of specialists, a galaxy of investigations, and a galaxy of rehabilitation. In the center, you have this person without whose decision you just can't move forward. So whenever you're forming a team, don't forget to include the most important member of this team, that is the patient. Now I'll just summarize all these things now about a team, and we can see we have multiple specialists, a patient, we have support groups, and then we have paramedical personnel as well to form a team now. So if you just take a disease, like if you happen to take diabetes, you just go through the circle, how many list of specialists you can make out there. So all these specialists, they have to collaborate, and then coordinate, and then they have to deliver healthcare services, which includes the patient decisions as well. And next, I'll just show you another a patient who is suffering from cancer, and then we have an autoimmune disease. You just take any disease, name the disease, you have a multidisciplinary approach should be projected there, and then you have to have coordination and collaboration. So we can see it's not only patient care doesn't go in a simple way, and how to constitute these teams. If you want to constitute teams, I'm just giving you a sensitization about that there are different types of teams we can constitute. So if you see the types of teams, if you take the patient population as a whole, there is a team which works on children, that's a pediatric team. If you happen to divide the population into an older age group, then we have another team which we call it as the geriatric team. So this way also you can have a team. It depends on you can have an acute care team, you can have a home care team. So if you happen to take the disease and then you want to form a team, then you can have a diabetic team, and then you can have a stroke team. And if you happen to take care delivery as a team approach, then you can have a primary care team which works as a primary caregiver, and then we have acute care teams. So acute care teams can be there, and we can have another team which can look after the patient and deliver home care. These are home care teams. So if you are having so many teams, then that is itself is not enough. Again, we have to rethink, because these teams which we have formulated, they can work effectively on their own, but at the same time, comprehensive healthcare is not delivered there. That was our target, and we have picked up a few points from the definition which we have seen in the previous slides. We said, whatever thing happens, comprehensive healthcare, unless and until provided, there are a lot of setbacks which are occurring in which we have seen in another slide. Now we'll just have to focus on not only teamwork, but on delivering a comprehensive healthcare. Now my emoji is very happy because I put a few positive steps there, and again I had to stop there because comprehensive healthcare was not being delivered. So then science come into play. Whenever we have a problem, science come into play, because we are all scientists here, and even if it's teamwork or a simple teaching methodology, then we have to go with science only. But because we are all medical educators, we have done a basic course in medical education, and some have done advanced course in medical education, and we have a galaxy of fellows also sitting here. But I take the basic concept of medical education, and then I try to apply it to a team science. So the basic thing, when it comes to teaching learning, we have seen that there is an input, a process, and an output. And then we have a feedback, which changes the input or changes the process so that we have a better feedback. Now we'll try to apply the same so that we can register the thing more better than going into other types of modalities. We have a team science framework in healthcare. Now this is what has been given as this is the science behind going with the teamwork. So if you see the team science framework which is being used in healthcare, so we have the center name has changed. We have input, we have an outcome. Instead of output, we have an outcome, and in the center, in process, we have mediator. So this is the framework in which we have in inputs we have a team member, and how do you structure this team? The team structure also matters a lot, and which type of team you want to take and which type of input you want to give here, and then the context. The context of the organization in which the organization is working. These three things form the input of team science of teamwork. Then we have some mediators. That is the process which is happening here. We have action teams, we can have transition teams, and we can have interpersonal process teams. I was telling you, if you want an example of an action team, like you have a stroke team, or you have acute care recovery team. MI occurs and directly he comes into the ward, emergency ward. We have an emergency team there. So those are action teams. And then we have transition teams as well. I was telling you that if you happen to shift a patient from a pre-operative into operative ward, operation theatre, and from an operation theatre into a post-operative ward, there is a transition occurring there. So these are transition teams also can be formed here, and effective and emergent states can also be taken into account as a process. And outcome, ultimately we need a safety and quality of the patient, and then team member safety and team member quality, and at the same time whatever the things which I told you in this previous slide, like boredom, safety, and loss of interest in work, all these things have to be addressed when it comes to the outcome. And you can see an arrow there. So this is the feedback process which is going back, and now it affects the input now. So if the feedback is not good, we go back again and we have to see that the input or in the process something is going wrong so that we can have an effective output. What has been added extra to our medical education team? So we have this one. These are all the modalities which keep on changing and the process in which the output comes. This is a continuous thing happening which is present here. Team training has to be done as a refresher course to all the healthcare personnel who are there, and at the same time we have to have team measurement methods, whether the team which you have formulated is going in a proper way or not. So if it's not going in a proper way, then we have to again look back at our input mediators and see that the output comes back in a normal way. So this is this IMO framework which I've been showing you on this slide. This is only for a team. Like I have a disease team, stroke team, like I have a diabetic team, I want to have an oncology team, or I want to have a stroke team. So that is enough for that. Now I was telling you that interdisciplinary collaboration is very important now. Then I need to have another table or another science to improve interdisciplinary collaboration. So this is another framework thing, which shows how to go about with an interdisciplinary collaboration. And these are these black things which are present here. These I showed you, in input, mediator, and output. This is one team, the component team 1, component team 2, component team 3. Like this, we have some teams. Now in this, how to develop an interprofessional collaboration. We'll take it as an example. If you just see the team 1, 3 and 5. Team 1, 3 and 5, which are lying in a horizontal line. So we'll take an example. The team 1 is a pre-operative team which does a pre-operative evaluation for a patient. And then component team 3 is the surgical team, and component team 5 is the post-operative team. So everything goes in a sequential order, and in between we'll be having transitioning teams. This is how you happen to establish interdisciplinary collaboration. This is one example. Now I'll just take team 1 and team 2. If we happen to take team 1 and team 2, so we have something which is known as an intensive coordination. This, I take an example of a primary care physician who refers the patient to a consultant, and now both are in coordination. This is an intensive coordination which keeps on happening frequently, and this is one type of coordination which we have to establish. And the third one, if I happen to take, we have component team 3 and component team 4. We have two oral arrows which are running from here to there. We have a staff nurse who wants to discharge a patient and send him to a rehabilitation or physiotherapy, and now they have to interact with each other. This is again another interdisciplinary collaboration. So if interdisciplinary collaboration is there, then comprehensive healthcare is delivered. That's what my whole point is. In spite of having multiple disciplines and a fragmented approach, if interdisciplinary collaboration is established, so the patient, the system, and the medical care personnel, all of the three are benefited. So we have some principles of healthcare for a team-based healthcare, and the goal should be shared. Not only sharing goal with the patient, then you have to look at the patient also and share his values as well. Whatever the patient wants to say, then you have to make a coordinated effort to see that the patient sharing is done, the goal sharing is done with the patient. This next thing is clear rules. You have to stick to your own rules, and you should not override and overshadow other people while doing a teamwork. And most important of all is effective communication. If you don't have effective communication, the whole of the system fails. So communication skills are very much important when you're going for an interdisciplinary approach, and this is the mainstay of doing a teamwork. So we have measurable process and outcomes. We have so many processes which are still in the pipeline. We have survey methods, and then we have validity methods. We have validity methods for content and for validity methods for content structure, which you are doing. So all these methods are coming into the framework again, but still in the pipeline, and we don't have any proper point on how to do an evaluation. So leadership is one important thing again. An effective leader can lead a team very well. So leadership skills have to be established to form an effective team in an IMO network. Ultimately, coming to the bottom line, if you see, these are the 6 C's which have to be followed while delivering a comprehensive health care. And care, compassion, competence, communication, courage and commitment. These are the 6 things which form an effective team to function effectively. These are some of the benefits of teamwork. The thing I put there in red, and I could not place it anywhere because the slide was becoming too large. So that's why I put it in red, but it comes into the patient benefits. So if we talk of patient benefits first, for the patient there is reduced time, and costs of hospitalization are reduced, which will benefit the patient immensely, and there's enhanced satisfaction in the patient, and then acceptance of treatment is better because a multidisciplinary, a comprehensive care is being delivered. And at the end, if you look at the outcomes, improved clinical outcomes as well as psychological outcomes are also there. The quality and all is improved, and medical errors are reduced. I was telling you about transition care errors, we are talking about medical errors. All these are reduced only because of interprofessional collaboration and communication. So ultimately, the patient gives an improved experience as the outcome is better and organization improves. We have a private organization like Apollo Hospitals. ultimately the organizational quality improves and ultimately the organization also improves there. When you come to the team members, first, because of interdisciplinary collaboration, a lot of knowledge is gained from the other departments. When you're doing a teamwork, so we tend to gain some knowledge from the other departments as well. And one, we have enhanced job satisfaction. And as we are sticking to our roles, we are learning how to stick to our roles. We have a greater role clarity also, which was not there previously. And there's a sense of enhanced well-being. The most important of all is reduced burnout, because once burnout sets in, there's a lot of fatigue which comes into the organization, and the work efficiency reduces thereby. So enhanced job satisfaction is also there. And team benefits, there's an improved coordination of care, and we have efficient use of healthcare services, and enhanced communication, which is interdisciplinary, and professional diversity as well, and increased resilience in risk situations. So you take a trauma team, for example, there's increased resistance in crisis situations. So in case when you talk about a trauma team. Organizational benefits are, so a reduction in unexpected admissions, and services are better accessible to the patients, and efficient usage of resources and time. So these are everywhere we have some barriers and challenges, and these are the barriers and challenges which have been found out during studies which we have done, and this study shows that changing roles. So the roles change from time to time, and changing roles we have to have the team should be adaptable. As I was telling you, they have to learn fast and adapt fast, and that's one of the characteristics of an effective team. Settings keep changing depending upon the day, the disease outbreaks and disease variations. We have the hospitals, and like you have a bigger hospital, you have a smaller hospital. So based on the settings again, then we have to bring out changes. So healthcare hierarchies are one thing. Like we have a CEO of an organization who directs us to do something. So again we have to, the team work changes, and then we have to look at the team hierarchy also. So individualistic nature of healthcare, instability of teams, and resolving disagreement and conflict which comes up. And we have how team formation occurs. We know that there is a norming, forming, performing stages. So that stages will be applied here, and when we are applying that to teamwork, the same thing goes about with this teamwork. And a lot of disagreement is there initially, and a lot of conflict is there, but gradually the team tends to adopt and then come to a conclusion while following up with a common goal, commonly shared goal, and that is the delivering comprehensive patient care. So we have, if this teamwork is applied and interdisciplinary collaboration is maintained, now a target which was still a common goal, which is being taken by, which has so many paths are been taken by these three specialists who are running towards a target. But now what we have is, we have a unified thing, one arrow we hold together, and then we go forward to deliver comprehensive healthcare. So these are some of the references, so through which we have gone through. And I thank Team Kausalyavardhanam for giving me this opportunity on the stage. Thank you.
Kumar Mishra sir, Vice Principal, Professor and HOD of Community Medicine Department, GSL Medical College, Rajahmundry, to present memento and certificate to Dr. K.V. Ramprasad sir.